All right. Good morning, everybody. My name is Rachel Taylor. For those of you who have never worked with me before, I primarily do small groups, but I also do the weekly webinar Wednesdays. I'm either live or in the chat. Welcome to everybody here today. How this chat is going to work, it kind of depends on where you're joining us from. So if you're in GoToWebinar, you're going to utilize the question box to chat with Morgan, who's on to answer your guys' questions. On YouTube, you can just leave a comment and Morgan can answer you there, and same thing for if you're joining from Facebook Live. So the first question I really want to ask you guys is, how many times have you maybe taken the NCLEX before? Let me know. How many times have you taken the NCLEX and where are you joining from? We're going to start with just a little conversation. In that question box, you can type, okay, we've got a couple who've taken 2 times. Awesome. Welcome from Canada, Florida, Nepal. Some of you have taken 1 time. California, welcome Grace. Welcome Brenda from Ohio. Welcome Numsi from Canada and Maureen from Canada. Okay, we've got a few people who've taken 3 times. Welcome Christina from Illinois. Okay, you have taken 4 times. What do you guys feel? This is just to get us started. We'll get into everything in a moment, but what do you guys feel like your biggest barrier to being successful on this test is? What do you feel like is holding you back? Do you feel like it is taking the NCLEX? Could it be the actual test questions? Could it be test anxiety? Is it maybe your prep work? Where do you feel is the area that you're struggling in? Where's your barrier right now? Let me know in that chat box or question box, depending where you're joining from. Test anxiety, fear, anxiety again, prep work, problem solving. I go through this because we are going to hit a lot of these things today. Testing strategies, SATA questions, content. Okay. All right, guys. So we just talked through our barriers. We talked through how many attempts that you guys have taken. The first thing I want to do with you all is a mindset reset. The reason why I think this is so important is because when you take your NCLEX and you're not successful, it can be disappointing. And that is okay to feel disappointed. And it's okay to take a little time to grieve if you need to. So what I really want you guys to do is I want you just to take a few deep breaths, in through your nose, hold, and out through your mouth with me. Do it one more time, in through your nose, hold, and then out with your mouth. I want you to shake out your shoulders. It is okay if you have not passed your NCLEX on your first attempt, on your second attempt, on your third attempt, on your 4th attempt. I recently just had a student who passed on her 12th attempt. It looks different for everybody. The NCLEX is hard, guys. Being a nurse is hard. It's okay to give yourself grace. It's just like when you were a kid and you first learned to walk. You fell down quite a few times, but you got back up, you kept trying. And we need to view the NCLEX the same way. It might knock you down when you're not successful, but get back up and keep trying, guys. It can be very depressing. It can lead to a lack of confidence. And my goal in this hour is to build that, to help you guys feel after this hour that you are ready to try again, that you are ready and you know what to do to make this attempt successful. Archer is here to help you guys break down these difficult concepts. We are here to help you all improve. Give yourselves permission to fail. Like I said, it is okay to grieve. If you just failed last week, I saw a few people that happened recently. If you need to take a week or 2 off, do that. But what I want you to do in your planner or in a calendar is write down the day that you're going to start again. But if you need a few days, it's okay to give yourself a few days. You are not less than. The number of NCLEX, guys, attempts that you take does not define what type of nurse you are. okay? It does not define what type of nurse you are. Some of the best nurses I have worked with had to take their NCLEX multiple times. That is okay. What our patients and clients care about is that we're compassionate, that we are caring, that we're understanding, okay? They don't ever care about how many times did it take you to pass your NCLEX. So keep working hard, guys. Now, the first thing I want to do is called microlearning. And this can really help you guys with those topics that you just don't like. So we're going to take just a few minutes. We probably won't take the whole 5 minutes, but I want you guys to get out a piece of paper, or you could type this list on your phone, on your mobile device, or open up a doc on your computer and type this. And I want you to call it your most dreaded list. I want you to write down a list of, let's say, 5 concepts that you dislike the most. Whatever you struggle with the most, you dislike the most. If you want to pop them in the question box, I'm going to start this timer. And I want you guys to think of those topics that you really just don't like. Okay, we've got someone who said endocrine is that most dreaded topic. Hematology and oncology, pharmacology, EKGs and nutrition, neuro, respiratory, SATA. Okay, guys, it looks like you're getting this list. Now, we're going to review exactly what to do with this list a little bit later. But to utilize microlearning, this most dreaded list is something that I want you aware of, because every day that you study, you're going to start your studies by pulling out this list. And you're going to give yourself just about 10 minutes, a few minutes each topic to review those concepts. If you do this regularly, the goal is that you feel more confident in those areas. And maybe next week, it won't be on your most dreaded list anymore. So the goal is to reassess this at the start of each week. If your most dreaded topics are the same, keep them. Keep working on those every day. Just a few minutes each day to review them. If they're different, though, you can change a few. Some may stay the same from week to week. Pharmacology may be one of those, but some of them might change. And this microlearning just gives you this short little burst of learning. Now, we'll get more into that, but I want to go over a few more things before we hit that microlearning any further. So previous attempts. Let's analyze your last attempt, just the last one. If you've taken 3 or 4 times, I just want you to think about your very last attempt. What were the results of that candidate performance report? What areas of the NCLEX test plan were you maybe below in? Anyone remember what areas? Basic care and comfort, maybe health promotion and maintenance, pharmacological and parenteral therapies. Any ones that you remember being below? We'll get to how I want you to study. We're going to get to all that, guys. I promise. We'll have time at the end for those questions. I promise we'll get there. We've got a few things to hit first. Physiological adaptation, psychosocial integrity, okay, reduction of risk potential, basic care and comfort, health promotion, and maintenance. So the reason why I want to make sure that you're aware of what areas you're weaker on is our on-demand videos hit most of those test plan areas. So if you're like, basic care and comfort is my weakness, okay, then you can do a specific basic care and comfort review. If physiological adaptation was your weakness, well, then you can just target that area. And I can show you guys that at the end if you're unsure of where to do that in Archer. If you were near passing in all areas, it means that you are right there. You are so close. You just need to go one step further and you should have it. Near passing in all areas, what I recommend doing is doing a broad overall review over all areas again before your next attempt. Now I want you to analyze. If you want to pop this in the chat, you can, but how did you study for this last attempt? Because the key thing here, guys, is how did you study and where can we improve? Because we don't want to study the same as what you did the last time. I need you guys to study different. I need you to do something different this go around. So think about how you studied. What things worked really well for some of you? Let me know in that question box. What studying tools did you utilize that worked really well for you? Doing practice questions, absolutely. I recommend doing them every day, at least 5 days a week. Yeah, cramming is usually not the best method of learning, but life happens, totally understand. So it looks like a lot of you guys are saying doing questions, doing videos. Awesome. Okay, so where could we improve then? Maybe it's your critical thinking. Maybe it's your application. You've got the concepts down. You're pretty good at test questions for the most part, but your application of that content has a gap a little bit. I just want you thinking on this so that as we go through, you can figure out which area do you need to focus on a little more. And how many of you guys struggled with test anxiety? I already see a few of you said your mind went blank, and we're going to talk about this a little further. So test anxiety, what is it? This is a performance stressor, and it happens a lot in nursing school as well as in the NCLEX. The reason why is because we consider this high stakes testing. It leads to a lot of added test anxiety because we have this feeling if we don't do well, it's going to have a huge impact. And then this leads to what is called thought blocking. So if you're somebody who said, man, my mind just kept going blank, I couldn't recall what I previously knew, that is thought blocking. Now, if you're somebody who is struggling with this thought blocking, we really need to work to decrease your anxiety. I've seen anxiety, guys, be one of the sole reasons that somebody struggles to pass their NCLEX. Once they manage that anxiety, they pass their next attempt. Now, another thing that I see causes anxiety is outside stressors. So I want you to analyze your own outside stressors. This may be a job you've accepted. This may be family members or friends asking you when you're going to take your NCLEX. Whatever your outside stressors are, I want you to let those outside stressors go. I want you to pass this test for you. Why did you become a nurse? And remember that. That's why I want you focused on not all the outside stressors, because otherwise it's really easy to get caught up in anxiety. Now, how to get over it? Great question, Sydney. Well, first off, we need to work to prevent it. Then we'll talk about how to combat it. So I want you to be prepared for some test anxiety on your test day. If you are someone who normally has test anxiety, you're going to have it on test day. It's not going to be eliminated. You're just going to know how to manage it. And a little bit of test anxiety, mild test anxiety, is actually good because it increases our performance because it allows for a heightened awareness. It's once you get to those moderate to severe levels that it's not good anymore, that it starts to cause your mind to go blank. You might become nauseous, tachycardic, etc. Now, something that I see, guys, is a direct correlation of students who lack confidence, who have an increase in test anxiety. This isn't everyone, just a correlation that I've noticed. So if that is you, I want you to work on building your confidence up before test day. Well, how can you do that? Get the scores that you need, set out goals and reach those with readiness assessments. If you have Archer, okay, you have our Q Bank, get 4 highs or very highs consecutively on readiness assessments. If you get that, you deserve to be very, very confident about this exam. If you've gotten through most of our Q Bank, you deserve to be pretty confident about this exam. If you've given this all you've got, you deserve to be confident about your exam. Now, something I want you guys to consider is adequate studying and reviewing. So a few of you said that you crammed. I want you to think for a moment. Did that work for you? Was the cramming helpful? So what I really want you guys to think about, instead of trying to cram all into 1 week, and I get it, you guys are busy, you have lives, you're working, but that cramming probably didn't work very well. The reason why is our brain can only pick up so much information and put it into our long-term memory and understanding. So if you only study intense for 1 week, your brain's not able to make as many connections. But yeah, they said it didn't work very well. But if you're someone who studies over a month or 2 months, your brain is able to make more of those connections. Now, a key concept to adequate studying and reviewing is consistency. What I sometimes see students do is they're consistent for a week, but then they get a really busy week and they stop being consistent. And then it's hard to get back into that groove again. What I recommend you guys do, so I have a planner. I carry this planner everywhere with me, so I always have it. I recommend you all get one and write down each day, when are your study times? When are you going to study? What are you going to study? And if you have that time set aside for studying and you check it off when you're done, it's a lot easier to make sure that you don't skip too many days. I usually recommend 5 to 6 days a week. Always give yourself 1 day off to rejuvenate. Now, the last thing is know your personal signs that anxiety is building. If you can recognize when your test anxiety strikes, you can stop it before it gets too high. So in the chat or question box, let me know, what are your earliest signs of anxiety? Mine, I turn bright red. If I mess up, if I say a word wrong when I'm tutoring, I turn bright red. You guys can probably see it if you've been with me a while. If I make any mistake, I'm bright red, I'm tachycardic. What are your guys' earliest signs of test anxiety that you notice? Because this is when you need to combat it. Okay, some people get frustrated, angry. Some people get a little shaky, tachycardic, tremors. Yes. Your mind goes blank. You can't continue to do questions. Okay. So if this is how you guys are feeling, some people start sweating. That's me too. I start sweating as well. Acid reflux. Yeah, some people get a headache. They feel like they have to go to the bathroom. Absolutely. So we need to combat that test anxiety. When you notice your earliest symptom, I want you to implement these measures. The first thing, guys, is positive self-talk. What is this? Well, a lot of times we can be negative with ourselves. We can be our own worst critics. And so we'll say things like, I'm never going to pass this NCLEX. Maybe you've said that even today. If that's how you're feeling, I want you to scratch that mindset. And I want you to say, I am capable of passing this exam. I have worked hard. These are the things I've done. I deserve to have confidence. This mindset reframing from a negative mindset to a positive one, guys, I can't emphasize how important this is. I see this be a key component of people being successful on their NCLEX. Now, after you've reframed your mind, I want you to take a few deep breaths. Now, what I like to do is I like just to sit upright. I take a nice big deep breath in. I hold and I exhale. I do that 3 times. Morgan likes to utilize what's called box breathing. She breathes in for 4, holds for 4, and then exhales for 4. The counting distracts me for some reason, so I just like to breathe in, hold, and exhale. I always close my eyes. That way they can tell I'm not cheating, but I always kind of glance away from that test. I'm no longer focused on that question. My eyes are closed. I'm focused on bringing down my anxiety. The next thing I need you guys to do is release tension. So what I want you to do is tense up all your shoulders, your muscles in your shoulders, and release. Tense them all up and release. Do that several times. The reason why is we hold our anxiety in the back of our neck and our shoulders. When you start to release this, it's going to help bring that anxiety down. And lastly, redirect your focus. Something that I see builds anxiety is students counting how many static questions they've gotten, how many questions they think they've missed. Well, What I want you to do instead of that is I want you just to focus one question at a time. Don't try to self-evaluate. When you just do the best you can on each question you see, well, that is going to help you focus on just what's in front of you, not what came before and not what came after. It will help keep that anxiety down. If you cannot break that anxiety after utilizing these methods, raise your hand and take a break. Just raise your hand, take a little break. Now, there's multiple different study plans that you guys can use. So someone just said, I don't know where to start. This is where I want you guys to focus. So there's a 6-week plan. With this 6-week plan, if you've taken 1, maybe 2 times prior, the 6-week plan is a great option. Or if you haven't tested at all, 6-week plan is perfect. This is really good for students who have more time to study every day. Somebody asked earlier, how long do I need to study each day? Well, this plan requires about 4 hours of studying a day. About 4 hours of studying a day. Some days are a little less, some days are a little more. Now, when we look at our tutor mode questions versus our readiness assessment and our CAT exams. Tutor mode questions, you can see the answer right after you take them. Those are great for practicing from day to day. Once you do that and you get pretty comfortable, that's when I want you to start those readiness assessments. You can see that there is one here in week 2. The readiness assessments, some key things when you take these. I want you to take some of them outside of your home. I know that sounds kind of silly, but you're really comfortable in your own home. Try a library or a coffee shop, because when you go to the testing center, it's a different environment. I also want you to have a whiteboard, just like what you would on your NCLEX, and don't take breaks, as well as take that readiness assessment at the exact same time that you would take your NCLEX. So if your NCLEX is scheduled for 8 a.m., practice these at 8 a.m. Now, what I mean by don't take a break is don't take like a 3-hour break. Act like it's NCLEX. If you need a few minutes, step away just like you would, but don't get distracted doing something else and then come right back to that test. Now, once you start getting comfortable with those readiness assessments, then you will start CAT exams. The CAT exams, okay, they are going to adapt to your testing ability. Now, if you're someone who is testing in April, which most of you most likely are, or May or June, you're going to have the next generation NCLEX. So our readiness assessments, our CAT exams will be updated to include those NGN items starting April 1. Now, those CAT exams are going to adapt to you. So what you're going to see as you're taking them, if you're getting questions wrong, you might get easier level questions. And as you start getting them right, you're going to get harder level questions. It adapts to you. The goal is to get a pass. What I want you guys to do before you attempt again, 4 highs or very highs consecutively, which means in a row without getting a borderline or a low. And I want you to have 1 or 2 past CATs. Those are my big goals for you guys. Now, the 6-week plan and our 12-week plan, they're going to be updated actually by next week, because we are launching all new videos. The content is pretty much the same for next generation NCLEX, but our presentation of some of our concepts will look a little different next week. We're going to upload new videos, give you guys the most up-to-date content. With that, you're going to get a revamped study plan. So if you're starting this week and you're like, oh shoot, the study plan changes next week, the videos are changing next week, I want you to check back in next week and use the most updated version. But if you're like, where do I start then right now? Because next week it'll look a little different. What I want you to start with right now is start with just week 1. And then as that new content updates, you can just start where you left off. Now with the 12-week plan, if you're somebody who has taken 3 or more times, I recommend at least the 12-week plan. It's really good for students too who have busy schedules. Maybe you work multiple jobs. Maybe you have kids. You have a smaller daily time commitment. This requires about 2 hours a day, sometimes a little more, but about 2 hours a day is what the 12-week plan is focused on. Now, if you want to do some practice questions on the content for the day, I want you to max at 15 to 20. What I mean by this is each day you typically do anywhere from, 25 to 75. We're going to up that probably to 85 questions a day. I don't want you doing 85 safety and infection control questions on the day you watch the safety and infection control video, because then you're not going to keep getting them on your readiness assessments if you answer all of them. So what I really, really want you guys to do is I want you just to choose maybe 15 questions, do 15 specific questions. Did you get what you needed to from that content lecture? And then do overall questions for the rest. Now, let me answer some of these questions that are coming in. You can do it where you just do videos on one day, questions the next. But if you're doing that, you'll have to kind of up your number of questions, up your video time, but you can make it work. Do what's best for you. But what I want you to always assess at the end of your day is, did you learn from today? What did you learn? Did you benefit from how you studied? If the answer is yes, and you learned a lot, perfect. But if you reflect back and you realize, I didn't learn a whole lot from my study sessions today, then you need to change it up. Now, my last kind of option that Archer offers is intense prep. This is a challenging program, but it's really designed for students who just need a little more structure. I am somebody who loves structure, okay? I don't like to just pick and choose each day what I'm going to do. I like structure. And with intense prep, that's where you really will have that structure. There is a 6-week schedule. It includes 3 to 6 hours of studying per day, 5 to 6 days per week. How intense prep works is on Mondays and Wednesdays, you guys have small groups with an instructor. The groups are limited to 20 to 25 students per group. And on Mondays, you have a feedback session of how are you doing? How can you improve? And on Wednesdays, you go over how to answer select all that apply questions. You go over how to answer NGM questions. All of those things occur on Wednesdays. And then Tuesdays and Thursdays, you have live 3-hour lectures with Lexi, one of our other tutors. And then you also get access to live case studies that are offered on Mondays, Wednesdays, and Fridays. Tons included. There's also worksheets, case studies, flashcards, and the regular practice questions, as well as CAT exams. Now, there's some other ways you can study. These you should really use in conjunction with one of the plans I just showed you. So think for a minute and let me know in the question or chat box, what plan are you guys intending on using? Are you intending to use the 6-week plan? Are you intending to use the 12-week plan? Are you intending to maybe consider intense prep? Where are you guys at right now? If you're currently in the middle of a 6-week calendar, finish out that calendar. But if you're just getting started, I would change and update next week. Okay, it looks like quite a few of you are looking at that 6-week plan. Awesome. Perfect. If you're already, guys, if you're already 3-4 weeks in, just finish out that plan, okay? If you are 1 week in and you're just starting today, what you can do is you can just cross off the days you already completed on the new plan and then kind of update it if necessary. Looks like a few of you are considering intense prep. Awesome. I'll show you guys where to find all that at the very end. Now, some other ways that you can study. You can do concept mapping. You can utilize flashcards. You can write your own, or you can download the app Pulsed In. I absolutely love this app. So it's kind of like a social networking for nursing students, nurses, but what they have in Pulsed In is a study tab. It has case studies included. It has pod pulses, which are podcasts, and it includes probably thousands of flashcards now. It was hundreds when it first started. I think there's well over 1,000 flashcards now. You can utilize them on your mobile device. So let's say you're waiting to get into an appointment. You can just open up Post-it on your phone and you can start going through those. Now, get a whiteboard, okay? Each one, I want you to pretend that you take a readiness assessment. I want you to pretend like it's NCLEX. Why? Because this is going to help you identify that anxiety. Where does it happen? When does it happen? Practice those measures we talked about. What works for you? What doesn't work? Another key thing, I want you to take your notes in your own words. Why is this so important? Well, if you write down exactly what I say or exactly what Lexi or Morgan says in the videos, what happens? Well, you're not really learning, you're memorizing. But the key thing is that you can connect ideas to one another. So that's why I really want you to take your notes in your own words. Study FARM 15 minutes daily. If you're someone who told me FARM was your most dreaded list, I want you to work on this about 15 minutes every day. What I typically recommend is do it by class and by body system. So start with your cardiac meds. Go through each class of cardiac medication. When you're reviewing cardiac, when you get to GI, do your GI medications. Now, remember that most dreaded list daily for 1 week. I want you to spend 3 to 5 minutes writing out what you know on each concept. Then what you're going to do is go back to your notes, add as needed if you missed something when you did your 3 to 5 minutes, and then reassess that list at the end of every week. My goal is that your most dreaded concepts 2 weeks from now, you feel really confident in. And now you will have a new list of most dreaded concepts. If you continuously do that weekly, it's going to benefit you. Now, how to make a concept map. I like handwriting concept maps. You can, utilize a computer program to do them, but I really like handwriting them. How they work, you put your main idea in the middle. So for example, congestive heart failure. Then your sub-ideas, you may put medications, treatment plan. You may have patient teaching, labs that you need to check. So you have all your sub-ideas, and then you can expand those further. Then the lines, you can write, how do these connect? How do these ideas connect to each other? The goal of writing out concepts maps is they help you with critical thinking. They help you connect the dots, and they're going to be very beneficial for clinical judgment for the next generation NCLEX. How to get the most out of them? Handwrite them, use different colors. Make them organized so that you can read them. If you can't read them, well, probably not super beneficial. Review weekly. They take a long time to make, so I would each week choose whatever area you feel like is the most difficult for you and do one concept map a week. They take a long time, and I understand that, so only do them over topics that you're really struggling with. What topic do you guys think a concept map might be helpful with? Let me know in that question box. If you want to do intense prep, by the way, you do not need to do the 6-week plan. Intense prep, you will have a daily plan that is given to you. It's super nice. I absolutely love intense prep. It's one of my favorite things, honestly, about Archer. And they'll lay out exactly what you need to do each day. All right, guys, any ideas for concept maps? What are some things you might think about? Diabetes insipidus versus SIADH. When I was in nursing school, I made a concept map over that. Diabetes mellitus, that would be an amazing one to do a concept map over. Psych medications, absolutely. Psych meds seem pretty common on that NCLEX. Yeah, the different systems for pharmacology, hypo versus hyperthyroidism. Yeah, anything hypo versus hyper. Absolutely, guys. SIADH, nice. Those are amazing ideas. I want you to pick one of them, and the end of this week, try one. See how it goes. And at the end, assess. Did this benefit you? Do you feel better about the concept? Or was something else a little more helpful and this took too much time? Assess that. If it works for you, great. But not every tool I give you is going to work for each and every one of you. So that's why you want to assess and figure out what works early on so that way you can do what's most beneficial for you near the middle end half of whatever study plan you decide. Now, how to answer NCLEX style questions. I want you guys to start trying to see the test from the perspective of a test writer and as a nurse, not as a student. You guys are done with nursing school. So now we need to work on how would a test writer think? How would a nurse think here? I want you to work to learn to rephrase questions and use strategies. I want you to be in control of the exam, not the exam controlling you. That's when test anxiety comes in, is if you let that test control you. I want you to control the exam. Now, a little tip I have. When you get questions correct, celebrate your victories, guys. Congratulate yourself. When you get them wrong, though, do not beat yourself up. It's okay. It's all about that growing mindset that we talked about earlier. And what you can do the next time to get it right, that's what's really important about learning, that active learning. All right. Our first practice question. You are the bedside nurse on a medical surgical floor, caring for each of the following patients. In which order would the nurse categorize their fall risk from greatest to least risk? All right. Let's walk through this one together. So what I would do for a question like this is rank them in order and only look at one option choice at a time. So A, a 25-year-old female with a broken hand. All right, if we think about a 25-year-old, even if they broke their hand, are they going to have a very high risk of fall? Nope, so I'm going to put them at the bottom. I really recommend using your whiteboard for questions like this. B, an 87-year-old male, history of fall. They're also 87 with Parkinson's disease. Well, that sounds like they have a decent risk for a fall because they have a history, they have Parkinson's, they have 3 risk factors for a fall. I'm going to put them pretty high up on my list. Then I look at C, 45-year-old male taking acetaminophen for abdominal pain. Well, he has pain, so I would include that pain as one risk factor. So we're going to put C above A. And then let's look at D, 52-year-old female, blind, post-op day 1. Where would you guys plug in D? After B, after C, or after A? Where do you guys think D belongs? Good job. Perfect. Good job, Priscilla. So they're blind and they're post-op. So I would say this individual has 2 risk factors. So I would put D after B. Now, what I would do after I've gone through this, does it make sense? So the 87-year-old male, history of fall, Parkinson's. Then the 52-year-old female, blind, post-op day 1. Yeah, that makes sense. C, a 45-year-old male taking acetaminophen for abdominal pain. And then lastly, that 25-year-old female with a broken hand. That sounds perfect. B, D, C, then A is our answer. Nice job, guys. Here is a prioritization practice question. During handoff, the nurse was informed that a patient's serum potassium is 2.8. Little strategy here, guys. Anytime you see a number, what does that number indicate? So if I see 2.8 is that potassium, what does that mean to me? Good. Hypokalemia. During rounds, the first thing that the nurse should assess in this client should be. All right, I'm going to give you guys a few moments to try this one on your own. Put your answer in the question box, and then we'll talk about how I would answer it. Good job, guys. Most of you are getting it. Awesome. Absolutely. All right, guys, let's go through this one together. So, ability to balance while walking versus quality of peripheral pulses. Well, I'm thinking airway, breathing, circulation. Neither hit airway, neither hit breathing, but B does hit circulation. So I would eliminate A and keep B. Then I look at C. Respiratory status, looking out for shallow respirations. Absolutely, this can happen. Why? Because potassium is in charge of our musculoskeletal system. Our diaphragm is a muscle. So if that becomes weak, well, now we have shallow respirations. Now, airway, breathing, then circulation. I'm eliminating B because that is focused on circulation. C is focused on breathing. And then D, frequency of bowel movement. That's not focused on any airway, breathing, or circulation. I would eliminate that and choose C as my best answer. I only look at one option choice at a time. I do not read all four and then choose my best answer, because if I eliminate as I go, I'm down to at least a 50-50 shot. My chance of answering it correctly has just increased from a 25% chance. I like 50% chance a little more than 25%. All right, let's do another practice question. A 45-year-old man is rushed to the ER with reports of substernal chest pain and diaphoresis. Cardiac troponin levels were taken and found to be elevated. Ooh, what does that indicate, guys? Elevated troponin levels. The ER nurse understands that nursing interventions would focus on which priority? You're right. We're thinking myocardial infarction here. So what would you guys say is your priority? Put your answer in that question box. Walk through as you eliminate each answer, just like we did on the last question. Nice job, guys. Perfect. Absolutely. Look at you guys go. You're experts on priority already. Perfect. So let's look at this. Well, what happens in a myocardial infarction? We have cardiac cell death. We do not like that. So increase oxygenation to the heart and reduce the heart's workload. Well, if we do that, that's going to prevent further damage to those myocardial cells. So I like A. Let's compare to B. Prevent complications and confirm a diagnosis. Well, confirming a diagnosis doesn't help our client. It's not going to help save our client's life. So we should eliminate B. Then we compare to C. Alleviate the patient's anxiety. As far as I know, anxiety has never killed anyone. So it wouldn't be my priority. I would keep my priority with A because that's going to do the most good for the client. Same thing with pain. As far as I know, pain's never been the cause of death for anybody. So we can eliminate D and we would choose answer A. Wonderful job, guys. Now let's do a select all that apply question. You're working in the emergency department when a client with a suspected stroke arrives. According to the American Heart Association, the general immediate assessment and stabilization should include. Select all that apply. All right, we need to follow the 3-step select all that apply strategy that we use here at Archer. Step number 1 is to reword the question in our own words. So how would you guys do that? You really want it 5 words or less when you reword. So I would say stabilization of a stroke. Then we have step number 2. Are we looking here for positive true answers, or are we looking for negative false answers? What do you guys think we're looking for here? Good. We're looking for positive true answers because it says should include. And then step number 3 is to go through each answer choice one at a time and ask ourselves, is this a true statement or is this a false statement? So if we suspect a stroke, should we activate the stroke team? What do you guys think? Is that true or is that false? Good, absolutely true. Do we need to check and treat the glucose? If we have a suspected stroke, should we check their glucose levels? We are going to check and treat the glucose. Why? Well, because a lot of times when somebody has a low blood sugar, it can look like a stroke. And I would much prefer to just treat a low blood sugar than run somebody up as if they're having a stroke. I'd prefer it be a glucose issue instead of a stroke. Will we still rule out a stroke? Absolutely. But if we can check and treat the glucose, we may see an improvement of symptoms pretty quickly. Order an immediate CT or MRI. Ugh, sorry, guys. MRI of the brain. Now you're going to see me turn red. Okay, order an immediate CT or MRI of the brain. What do you guys think? Is this necessary if we think stroke? Why does this matter? Why do we care about a CT or MRI? Because we need to know if it's an ischemic or a hemorrhagic stroke. Absolutely, nice job. Now, if we have a suspected stroke, are we going to administer TPA? Without any further knowledge, are we just going to give TPA? Nope. Why? Well, because we can only give TPA for an ischemic stroke. We cannot give TPA in a hemorrhagic stroke or our client could bleed out and die. So we can eliminate D and E, start the client on a heparin drip. What do you guys think there? Are we going to put them on a heparin drip if we don't know what type of stroke this is? Nope. And not all candidates, or not all clients, I should say, are a candidate for TPA or heparin. It's dependent on a lot of factors. So A, B, and C are best answer choices here. If you got this right, celebrate this. You just got to select all that apply question correct. You guys can do this. Nice work. A, B, and C. Now, let's go a little bit more through your plan. I want to make sure that you guys feel confident on this. Real quickly before we do this, though, I do want to show you where to find all those resources that we talked about. So what you guys can do is you can go to Archer Review, search that. You can click on the link. You're going to see Archer Review, and you can find everything that we talked about. So under courses, you're going to go to nursing. You can find NCLEX RN, NCLEX PN, or Intense Prep. So I'm going to show you guys each of these really quickly. So NCLEX RN, discounted combos. What I recommend that you guys get is if you just want the videos on demand and the Q bank, okay, you can get a 60 or a 90-day package, or even 180-day if you're planning on taking a long time or a longer time before you take your next attempt. If you scroll down, though, the one that I recommend more than any other is the Next Generation NCLEX RN Rapid Review Live and On Demand plus the Q bank. What this gives you access to is you get access to our 2-day live review. We're going to work on how to answer those Next Generation NCLEX questions in that review. Our next 2-day live review is a week from now on Thursday and Friday. They run from 8 a.m. Central to 6 p.m. Central Time, both days, so the 6th and the 7th. So if you're someone just about to sign up, this is definitely the package I recommend. The Next Gen NCLEX RN Rapid Review Live and On Demand. For the PN, it's going to look the same. The only difference is the price is just a little different. And with the PN, it's going to say PN, but everything else will look the same. Then under Intense Prep, for those of you interested in Intense Prep, you can scroll down and you can see everything that is available. So here's all of our live lectures, okay? You can see every presenter that presents, tons of live lectures for you guys in Intense Prep. And our next group starts April 3rd, and it is with Diane Barnard. She is an incredible, incredible tutor. The price is $399. Now, if you're someone who's used Archer before, I recommend emailing support. If you currently have a plan, but you're like, man, I really wish I could add Intense Prep, but I've already purchased something else, but I really want Intense Prep. support can tell you the difference of the cost, and they'll just charge you for that difference if you've already purchased something in Archer. So that's something I definitely recommend when you're looking at intense prep. And lastly, if you're interested, there is tutoring as well, and you can take a look at that. All right. So yes, you guys can email support@archerreview.com, support@archerreview.com for any of those specifics that you maybe can't find on here. All right. So let's talk about your plan. What study methods are you guys going to use? We talked about case studies. We talked about flashcards. We talked about concept maps. What do you guys plan on utilizing? Yes, if you get intense prep, you will still have access to your account. Absolutely. What do you guys plan on utilizing? Okay, it looks like someone's going to try concept maps. Absolutely. Awesome. Anything else? I really want to make sure, whatever you guys decide to use, make sure you make good use of the study time that you have. Have everything ready to go at the start of your study session so you're not off grabbing things, you don't have to pause. And what I really like you guys to do is start with your hardest concepts first. You're going to start with your most difficult concepts the first 15 minutes of your study session, then do the stuff you're a little more confident in the last 45 minutes. What I really recommend doing is do multiple little sessions throughout the day. So what I typically recommend students do is 45 minutes on, 15 minutes off, several times throughout their day. You may do 2 sessions in the morning, 2 in the evening, or maybe you're going to do 1 in the morning, 2 in the afternoon, 2 in the evening, depending how your schedule works out. The reason why I recommend this is your brain learns the most those first 15 to 20 minutes. I really want you to work on developing your testing instinct. When you get a question wrong, I need you guys to analyze, why did I miss this? How could I get it right the next time? Was there any strategy I could have applied to this question? If so, utilize that. The 6 and the 12-week plans, they're guides. That's all they are, is a guide. You might need to adjust your plan to fit your needs. That's okay to do. And if you're really unsure of how to do that, I recommend doing a one-on-one tutor session so that you know how to adjust that plan. Now, we talked about confidence and how can you be confident that this attempt is going to be different? Well, I want you to do a quick little self-assessment. Ask yourself, what are you going to do different this time? Accountability, consistency are most important. Now, things get tough. I already saw some remarks in the question box about, man, I feel drained. I am burnt. What do I do? Remember your why. I want you guys to get a Post-it note, a sticky note, a piece of paper, whatever. And in your study area, I want you to write your why on this Post-it note. And I want you to have that up wherever you study, because that's going to motivate you when things are tough. You're gonna have tough days, guys. I had tough days in nursing school, but remember that why. So for me, my why I went to nursing school was I was really, really sick. When I was in middle school, I was hospitalized. I had to get my stomach pumped. And I had a pretty poor nurse that cared for me when I was a kiddo. But then I had an amazing nurse that cared for me. And she motivated me that I wanted to be like that. Then once I, graduated nursing school and I had kiddos, now my why is for my kids. Your why might look different from person to person, but whatever that is let that motivate you. On the hard days, on the days that you feel like you just can't do anything, I want you to try to watch one pod pulse, do 25 practice questions, review your notes, go through 25 flashcards, do something on the hard days. Just choose one of those things. But on the hard days that you just don't want to do anything, to keep yourself consistent, choose one of those. Now, somebody asked, are the live on-demand lectures and the intense prep the same as the live review crash course videos? So there are a lot of similarities. Absolutely. The on-demand and the live that Lexi goes through, they're pretty similar, but in intense prep, Lexi adds quite a few things to her live sessions. So she does warm-up questions. She does dosage cup questions, ABG questions every Tuesday, Thursday as a warm-up. She also has knowledge checks, and she goes over NGN practice questions at the end of every session. So her sessions definitely include a little bit more or go a little bit further into things than the on-demand lectures do, but they're very, very close to one another. So if you ever missed Lexi's live, you could easily watch, okay? You could easily watch the on-demand lecture and get the same concepts out of it. Now, if you're somebody who's never used Archer before, or you maybe haven't used it to its fullest, I will say our passing rates when we compare to NCSBN's average, when we compared, this was a year ago for Q1, but look at the increase in passing rates that we got when we collected data. If you're someone who's lacking confidence and you're like, I got the 4 highs, very highs, but I'm just not super confident, stats speak to me, so they may speak to some of you. When we look at that repeat attempt passing rate, so this would be you guys over here, that is 103.06% higher than the average repeat tester. So that tells me, guys, that if you use our program correctly and you use it to the best of your ability, your chance of being successful is pretty high. Okay, you guys have got this. Work on being confident. Now, if you need some more help from one of our experienced tutors, what can you do? Well, you can go to the Archer Review, go to private tutors and NCLEX, and you can see everyone that's available. So Lauren, myself, Kate, and Elizabeth all offer small group sessions. When we look at Elizabeth and Emma, they're our main one-on-one tutors. Hunter as well, he just doesn't have any openings at this time, but Elizabeth has openings for one-on-one sessions, and our amazing tutor Emma does as well. So if you're like, I absolutely need a one-on-one, I need to adjust my plan, these would be the best people to go to. How you would do that? You just click book now. You would go to one-on-one tutoring. If you book 3, you get a discount. At 5, you get a discount. And at 10, you get a discount. I personally usually recommend start with 1, come up with a plan with your tutor, and then you can book the rest once you have that plan set up with your tutor. Then you go to choose time slots, and you can see the times that she is available. Starting in April 4th are her first open slots. All right, guys, what questions do you guys have? I don't want you to give up. We at Archer are here to support you on this journey. I believe in you guys. You just need to continue to believe in yourself, show up each day, do your best, work hard, and eventually you're going to accomplish that goal that you have of passing your NCLEX. Now, in case you have any questions, I do want to give you guys my email. So there is something called the chat box in GoToWebinar. I can maybe have Morgan enter it elsewhere as well. But what you can find is my email, and it is rachel@archerreview.com. If you feel a little lost, if you're just unsure of what to do going forward, you can send me an email and I will gladly help you. I know that it can be frustrating. I know that it can be hard being a repeat test taker. And because I've seen that so many times, I know it helps if you have a little support. So we're here to support you. You guys have my email. I'll spell it out for you guys just in case you're joining on YouTube or Facebook. But it is RACHEL. So just Rachel@archerreview.com. So at ARCHERREVIEW.com. So Rachel@archerreview.com is my email address. What questions do you guys have? We have a few minutes to answer any questions. Do you guys feel like you know where to go moving forward after we had this free webinar today? If you ever see a question, what a great question, Jane. If you ever see a question that you don't know, you have no idea what the answer is, I have a few different tricks depending on what type of question this is. So if it's a question that it's priority, choose something that hits airway. Choose whatever might, be the most harmful to your client. Choose that. If you even don't know what it's talking about, choose whatever is the most harmful or poses a safety risk. If it is asking you about a nursing intervention, you can always eliminate if it takes the nurse away from the client. So you could eliminate those answers. Using those testing strategies can really help you eliminate. Look at just one answer choice at a time so you can get yourself down to 2. And then what I would do, trust your instinct, trust your gut, develop that testing instinct and learn to trust it. Now, SATA questions. Yes, you will be getting partial credit for select all that apply questions on the next gen NCLEX. Every SATA question will have partial credit. Now, there's a few different ways that SATA questions will be phrased to you guys. It'll either tell you, hey, there's 3 correct answers or there's 4 correct answers. For those questions, you get a point for each correct answer you have. The max you could choose is however many it tells you. So if it says 2, you can only choose 2. If you get both, you get 2. If you only get 1 selected correct, you would get 1. If it doesn't tell you how many are correct, if it's just a regular SATA question with an extended response, let's say there were 4 answers correct, you chose 2 incorrect, but you chose all 4 correct, you would get 4 for the ones that you chose correct, but then you would get subtracted 2 for choosing 2 incorrect answers. So that's how those different SATA questions will be scored. Okay. So yeah, you can still utilize the 6-week plan. It will still work, but we are updating the plan. So I want you aware of that. So that way, if you look and videos just look a little different or maybe have a little bit different of title, you're aware of that. But yes, if you're still working on a 6-week plan, you can utilize it. But we are going to update things a little bit. So just be aware of that. And will the traditional SATA going to be that plus minus scoring? Absolutely. All traditional SATA, every SATA question on the NCLEX will utilize that plus minus scoring. Yeah, it's really hard when those big life events happen. So sorry to hear about your husband's diagnoses. Okay. Pharmacology question. You're not sure what it's indicated for. Look for hints. Sometimes the question is going to give you some hints about what the medication is utilized for. If you don't have any hints, try to memorize endings of drugs. And if the ending matches a drug class, you know, answer it as if it fell into that drug class, even if you aren't 100% sure. All right. Let's see. If you just don't quite know where you're lacking or where you're struggling or what your barrier is, I definitely recommend looking at a one-on-one tutor session, and they can really kind of guide you. They spend an hour just with you to guide you in that right direction. All right, guys, I've got 1 more minute to answer questions. Let me see what I can get through. Normal values on the NCLEX for NGN, absolutely, they will give you the normal values. You have to be able to interpret them. So it's actually 1 step further with your knowledge. You have to apply clinical judgment now. So I really want you to understand those labs, not just know the ranges. You need to now understand them and what does it mean for our clients. All right. The QBank isn't changing a whole lot. That should look the same. The big thing that changes with the QBank is NGN will start being on those Fridayness assessments. So the algorithm, the passing standard for the NCLEX, according to NCSBN, the writers of the NCLEX, the passing standard did stay the same. There's a lot of mathematics that goes into the algorithm that I don't understand. I don't need you guys to understand it. I just want you to focus on doing the best you can and working on each of those areas of the NCLEX test plan. If you do that, the math behind how you get that pass isn't as important as, okay, how am I going to improve? Nice job. All right, guys. Yeah, I'm hoping the partial credit helps. I'm hoping NGN will actually be a good thing for students, especially those students who are good in clinical practice. Yes, you will still do the regular QBank. Thank you for asking this question. You will still do the regular QBank because 80% of your exam, guys, is staying the exact same. 80% is not changing. Only up to 20% of it will change to next generation NCLEX question types. The concepts are staying the same, just a few minor wording changes from the old test plan to the new test plan. The big difference is the percentages look a little bit different, just a little different on each area of the NCLEX test plan. And then how they're presenting the content in the question is what is the big change, okay? All right, guys, that brings us to the end of our time. I hope you got a lot out of today. Join us next week. I believe it's with Elizabeth for our next webinar Wednesday. If you're ever curious about what's coming up, check out our Facebook page. We always are posting it there. You can just look at Archer Review and you can check out our Facebook page to see those posted. All right, guys, thank you guys so much for today. I hope you enjoyed it. Good luck on your NCLEX and thank you for choosing Archer Review.